3 Night Watch.
When you're sick in the hospital, you depend on visits from your family and your pastor. But COVID-19 has put a stop to those visits. Standing in the gap are the hospital chaplains who shoulder a tremendous responsibility. Recently, I visited with some of the chaplains at St. Francis Emory Healthcare for a peek into their world during this pandemic. Pat Ingram is the chief of chaplains at St. Francis Emory Hospital. She and her team have a heart after God and a heart for patients and their families who've been separated at the hospital doors by the protocols of COVID.
We have been wired to reach out and touch someone, to give a hug, to wipe a tear. In this time of COVID, we can't do that.
Even as chaplains, we're just as human as the person that's in that bed, and yet we've been called to keep walking down that same fearful road, but keep walking. Because in the process of walking, in the process of moving forward, something miraculous is taking place. People find themselves knowing that I'm hurt, but I'm not alone. I'm worried, but I'm not alone. I don't know how this is going to turn out, but I got somebody to talk to.
Talking with family is always good medicine for the patients, and the chaplains are happy to make that happen.
And there are times when taking my cell phone and gotten permission to FaceTime the families with their loved ones so that they'll be able to see them and talk with them.
One of the loneliest places at the hospital is the parking lot where family members wait for results. The chaplains minister there too.
If there's a question that they have while sitting in the car, we'll try to go get the answer and then come back with the answer.
While the hospital staff is tending to their patients' physical needs, who's there to offer spiritual comfort when pastors and priests can't come in?
Pastors understand that we are their arms and legs and ears and prayers, and they will call the hospital and say, hey, I've got a parishioner here. Please go and see them. Tell them their Sunday school class said hello. Tell them that we love them. That happens all day long.
But the chaplains don't just focus on patients.
We do more staff care than ever. That means when we're rounding and seeing patients, the additional part of that is slowing it down to speak to the staff, to have prayer with the staff if they're asking us to.
Buddy Cooper retired from the ministry and had just joined the chaplain staff at St. Francis when COVID hit. And there are times when he needs a listening ear.
You come back often to our chaplain's office and you say, just need to talk a minute. And they're faithful to be a chaplain to you because you've poured yourself out.
And Bob, sometimes the forgotten heroes are chaplains whom we rarely see because we can't go into the hospital, but they're there doing, as we said, heavy lifting over the last 10 months.
What an